Here, we join a host of healthcare practitioners at Botswana's first ever infection control symposium, hosted by the Kutz and Tutz group, and presented under the theme Towards a Healthcare-Associated Infections-Free Facility. Does everybody do their bit?
Today's agenda is all about the science of health, that is, its promotion and its preservation, also known as hygiene, brought to you by the Kutz and Tutz group as they host the 2015 Infection Control Seminar. We find out more.
The event brought together experts, practitioners and policymakers under one roof with the objective of threshing out matters relating to healthcare-associated infections, particularly in healthcare facilities.
It is a fact that hospital infections impose economic consequences on the healthcare systems. Approved preventative measures and tools can greatly reduce the incidence of these health-associated infections and as a result reduce the socio-economic burden on the healthcare system, hence the controversial statement that I said. I wish to assure you that my ministry will continue to do its bit by putting in place all the necessary measures and tools to prevent infections as our health professionals give care to our patients. I therefore assure you of my engagement with my team to discuss and agree on the subject matter. I will surely now do my bit so that I can be relevant to your theme for today. I would like to encourage all of you gathered here today to engage freely in one spirit and go back to your workstations with the aim of improving service delivery on the site to ensure that our facilities are free of healthcare-associated infections.
Roger Wakeford Brown from Guest Medical UK shared with the crowd the current infection control issues in the UK, with special emphasis on the use of antibiotics.
We've known that the inappropriate use and prescribing of antibiotics continues to cause development of resistance. We know that many patients don't take their antibiotics as prescribed. We know that they skip doses, and we know that they don't always finish the course. NICE, again, have set out a draft guideline consultation document, which is designed to monitor and evaluate antimicrobial prescribing. It's called the Community Antibiotic Stewardship, and it's monitoring and evaluating antimicrobial prescribing. It's providing regular feedback to prescribers in all care settings about their prescribing patterns. It's providing educational and training to health and social care practitioners about stewardship and resistance. It's defining roles and responsibilities and accountabilities within that stewardship program. And it's providing mechanisms for reporting, updating, and communication locally, and including the use of IT.
Lynn Lowe from Dismed Pharmaceuticals in South Africa passed on her knowledge on hand hygiene practices and training, and shared an informative video with the crowd that showed how infections travel from one person to the next in a hospital setup.
Every year, an estimated 2 million patients acquire a hospital-acquired infection, which is quite a lot. Approximately 90,000 patients die from their infection. What are the factors affecting adherence to practice? Lack of personal responsibility, I think that one is self-explanatory. And then forgetfulness, okay? Understaffing could also play a role in the lack of hand hygiene or, neglecting hand hygiene. The intensity of care, the type of ward, it may not be a surgical ward where we feel hand washing is important at various intervals. Irritation and dryness of skin. You'll notice that this one keeps on coming up, and really we do find that our nurses are battling out there with dry skin, okay? During our training sessions, when we have our one-on-one, that's when we actually discuss the conditions of their hands and make a few suggestions as well.
A question and answer session gave the audience an opportunity to engage with the specialists and seek clarity on a number of high priority issues.
just for the mere fact that it breaks the integrity of the skin. Can you imagine if you, before each patient contact, you have to use a brush for your nails? By the end of the day, your cuticles might be bleeding. And I'm not saying that practice is wrong. But for a hospital setting where a nurse really have to wash frequently, and we want her to wash her hands, we discourage the use of a brush.
We want to be able to say, what is the advantage of using, for instance, an automatic hand soap dispenser versus a manual, without necessarily putting a brand name on it. The advantage of an automatic hand soap is that there's no touch. You try and avoid as much of touching as possible.
Please tell us how important hand sanitation is, and if it's not practiced, what is the worst case scenario?
Okay. I think we can't emphasize enough how important hand washing and disinfection of hands is, especially in our healthcare settings. And the main aim there is to ensure that we keep our hospital-acquired infection rate, really, really low. And if that is rocking, infection rates in our hospitals will spiral all the time.
The activities of the seminar were brought down to a close in an intimate and socially inviting cocktail dinner that allowed for networking and interaction amongst the large assembly.
How can the general public actually benefit from such a seminar?
Do you know what? It was more of an awareness than anything else. People needed to know about infection control in general. Not only that, even hand hygiene, because everything starts with good hands, healthy hands. And they benefited in the sense that they got information for the first time from the horse's mouth, being our suppliers from abroad, being United Kingdom, South Africa, and other countries.
Now, today you participated in the infection control seminar. What can you say to Botswana out there at home? Because it's the first time it's actually happening, as to what it is and how beneficial it actually is.
I think it's a great initiative. I think the first step is to organize, and infection control is a very important subject, very important topic, and it's a big risk factor with hospital-acquired infections. People are getting ill in hospital, and people are meant to go to hospital to get better, and I think this is a fantastic initiative for Botswana, and great credit to industry in Botswana that they've chosen to tackle this issue and try and improve the quality of healthcare in Botswana.